It's going.
Hello, my name is Angela Yambo, and I'm doing my process speech on how do your wound skills measure up. Okay, here's my audience. Okay, I have been a nurse for 13 years and recently became a wound nurse for the past year. The most important thing that you need to know about wounds is using correct protocol. I have demonstrated a wound right here. You need to know your wound. You need to know how to diagnose what wound is here. Is it a skin tear? Is it a laceration? Is it a discoloration? You need to avoid using the word bruising. Is it an ulcer, arterial or venous? Is it a red area caused by pressure? You need to describe the area. As we look at this, we're going to measure it. You need to try to use the same measuring tool each time. And you're going to measure from end parameter to end parameter. As you see here, this wound is going to measure 1.4. And you're going to do the length first. Then you're going to do the width, which is approximately 0.9 centimeters. You want to try to always use the same form of measurement. And centimeters is usually the most universal one that we use. For depth, you're going to try to put your finger and pinpoint here and actually put it in the wound so you can measure the depth of the wound. In this case, it's actually a 0.0 centimeter, but if this were a stage 2, which is what it's supposed to represent, it would actually be a 0.1 to 0.3. Okay, then you need to use a base point when you're measuring so that you can always do the same form of measurement as the next person. As you see, the nearest marker we have here would be his ankle. And it is actually, the wound is actually distal from this. Distal means closest to, and proximal means further from. So the crest of his ankle is right there. So you're going to actually put your measuring tool there. As you see, it's about 6.2 centimeters proximal from the area. Don't be afraid to measure. There's never too many measurements that you can do. You want to give the best indicative of where the actual spot is, because say Mary here were to come after me, she would need to know where I measured from to see if it's getting larger or if it's getting smaller. You need to describe the skin around it. Is the skin around it normal? Is it red? Is it macerated? Is it black? Necrotic? Is there any drainage? You need to make sure that you describe the drainage. Serous would be white or clear. Serosanguinous would be pink or red. Purulent would be greenish, brownish, and possibly fall smelling. You need to say how much drainage there is. Is there a light amount, moderate, heavy? The wound bed color. In this case, the wound bed color is actually black, so we would consider it necrotic. Update your charting. You always want to describe if the wound is stagnant, declining, improving, and if it's been 2 weeks and you've used the same treatment and you're having a stagnant or decline, you need to change your wound treatment regime.